In this video, I'm going to share with you everything that you need to know about blood pressure numbers. We're going to learn what's high, what's low, and loads more. I promise you, at the end of this video, you are going to become a blood pressure pro. Okay, so we're going to start simple. A normal blood pressure reading is 120/80 millimeters of mercury. But what do these numbers actually mean? So let's begin with the top number. In our example, it's 120 millimeters of mercury. This is always the higher number. It's called the systolic pressure. This is the maximum pressure on your arteries when your heart beats and pushes blood through your entire body to all your organs. Now the bottom number for this example, 80 millimeters of mercury, is known as your diastolic pressure. This is the pressure in your arteries between heartbeats. So basically when your heart is not pumping, okay, it's the pressure on your arteries then. And you can see the blood vessels need to maintain some pressure in them to ensure that blood is still flowing. Now here's the thing, this resting tension is actually really useful, because let's say you didn't have this resting tension and your blood pressure went to 0. Well, if that happened, you would literally go unconscious and fall to the floor. So it is necessary. So what are the risks of high blood pressure? Well, there's two that a lot of people already know about. Having high blood pressure can increase your risk of heart attacks and strokes. However, one that not a lot of people know about or think about is the irreversible damage to our organs, okay? Such as our brain, such as our kidney, okay? So high blood pressure comes with a lot of dangers. You see, the thing is that your organs, like your brain, like your kidneys, they weren't designed to deal with such high pressure, okay? It's that high pressure, it's slamming into it and causing the damage. It's kind of like when you used to watch cartoons and they'd show some kind of water heater and the temperature's going up too high, the pressure's too high, and you see the gauge flying up in the red zone and nuts and bolts flying everywhere. It's kind of a similar concept. It's a closed system and these organs just cannot handle that pressure, which causes that damage, which is generally irreversible. Next up, a common question I get asked by patients is systolic blood pressure or diastolic blood pressure more important, okay? The very easy answer is this. Both of them are as important as each other. If either systolic or diastolic is high, they're both bad for you, okay? And a very simplified way of looking at it is this. If you have a high systolic blood pressure, it means your heart's working really hard and your blood pressure is going up. And if you have a high diastolic blood pressure, it means that your arteries are always pressurized and stressed, and it's causing that high blood pressure. Both of them have complications and are bad for you. So the most important thing is that we get both of the numbers in range. So what is high blood pressure? I feel like there's a lot of misinformation out there. There's a lot of complication out there, so I'm gonna make it very simple for anyone who's watching. Unless you are told otherwise by your medical provider, your average home blood pressure readings should be no higher than 130/80 millimeters of mercury. That is it. Easy as that. Keep it below that, and it's healthy. So next up, let's talk about the Withings BPM Connect. This wireless Wi-Fi blood pressure monitor is clinically validated for accuracy and developed by cardiologists to provide medically accurate blood pressure and heart rate measurements. And it's incredibly easy to use. You don't have any wires, any tubes anywhere, you just put it on your arm, it's synced to the app on your phone, click the button, does your blood pressure, all the data goes on your phone, and you can share that with your doctor as well. It also has a really useful LED screen here, which changes color depending on your blood pressure, and on the app as well, it tells you what all the different readings means. So it makes it very simple to do your blood pressure management. And the Withings products are backed by doctors and medical experts. They're very good friends of the channel. I genuinely love their products, and one thing that I love about Withings is that they focus and prioritize on preventative health. To learn more about Withings and their fantastic products, I will leave a link in the description below. Definitely do check it out. Withings, thank you for being our trusted sponsor. Now, monitoring your blood pressure at home is a great idea, but here's something that many of my patients miss, and it's all about cuff size, okay? If your blood pressure monitor's cuff size is too small, it will potentially overestimate your systolic blood pressure by about 5 to 20 millimeters of mercury. Now, on the other hand, if it's too large, the blood pressure cuff size, it can underestimate your blood pressure by about 3.6 millimeters of mercury. And I guess the danger of overestimating your blood pressure is unnecessary treatment, unnecessary diagnosis of hypertension as well. So getting the right cuff size is extremely important. I have a video all about that, which I'm gonna link in the video. Also, using your blood pressure monitor is extremely important as well, and knowing how to use it properly as well. Again, I have videos on that too, which I'm gonna link in this video.